Good morning, guys. Or good evening. I'm sorry. It's morning somewhere. But anyway, today or tonight we'll be discussing something about acid-base balance, and we will be talking about some conditions related to imbalances between certain electrolytes and certain um, gases that can either lead to acidosis or alkalosis. But before we talk deeper about acid-base balance, let's establish some concepts first. Um, First, in order to have good acid-base balance, we need uh, we need to ensure that we have good functioning of the respiratory system and the genitourinary system, the kidneys, in charge of removal of some acids and some ions from our system can lead to acidosis. Um, and the respiratory system, which actually has the capability to either retain or remove carbon dioxide from our system. So, every day, the human organism is bombarded with a lot of basic and acidic compounds. And if we don't have a fully functioning respiratory and kidneys, then the body can easily succumb to this, elements of acidosis and alkalosis. So, if the body is exposed to too much acids from the foods that we drink, the drinks that we usually consume every day, the foods that we eat, then we will be susceptible to develop acidosis. And if not, then the other side of that, alkalosis can happen as well. There are three mechanisms that actually maintain our normal blood pH. The buffer system, I'll talk about that later. The respiratory system, which is again responsible for removal of carbon dioxide from the lungs. The kidneys, responsible for removal of hydrogen ions by the kidneys. So we need to define some terms. So what is pH or what is blood pH? How do we define blood pH? Blood pH, the pH stands for the power of hydrogen, and the blood pH determines how well our body can actually maintain internal milieu or internal balance. Um, the blood pH is between 7.35 to 7.45, but I'd like to emphasize that there's a very narrow range of pH values where light can exist between 6.8 to 7.8. So what does it mean? It means that any blood pH lower than 6.8, the human organism will die, and any pH value higher than 7.8, again, the human organism won't be able to survive with that. So in order to maintain normal functioning of the body, a narrow range of pH values between 7.35 to 7.45 must be maintained. Any blood pH lower than 7.35 will be considered acidosis, and any blood pH higher than 7.45 will be considered alkalosis. So, some of the gases involved with this, sorry, you have to remember that the lungs has the capability of removing carbon dioxide from our system, and carbon dioxide is a volatile acid, and aside from being a volatile acid, carbon dioxide is a potent cerebral vasodilator. So carbon dioxide, if we retain carbon dioxide in our lungs, then it can lead to what we call respiratory acidosis. The kidneys, on the other hand, being the master chemist of the body, has the capability to remove hydrogen ions as well. Just like what I said earlier, when you say pH, it's the power of hydrogen. And blood pH, therefore, is inversely related to the number of hydrogen ions in the system. The more hydrogen ions you have, the lower the pH will be. And vice versa, less hydrogen ions you have in the blood, then the higher your pH will be. So, if the kidneys or if the hydrogen ions are getting high in the system, then the kidneys are capable of removing excess hydrogen ions from the system, thus preventing acidosis, metabolic acidosis, that is. So you can probably deduce right now that if the hydrogen ions cannot be removed by the kidneys for some reason, maybe the kidneys is suffering from acute injury, or the patient is suffering from a chronic renal failure, any condition that will lead to a decreased functioning of the kidneys and decreased removal of hydrogen ions will lead to accumulation of hydrogen ions, and again it's tantamount to an increase or to a decrease in the blood pH. Remember, hydrogen ions, blood pH, they are inversely related. More hydrogen ions, lower blood pH. Less hydrogen ions, the higher the pH will be. So, there are certain mechanisms of the body that can help regulate the blood pH. For example, the buffer system. The buffer system are substances that prevent sudden changes in hydrogen ion concentration by either accepting hydrogen ions or releasing hydrogen ions. A good example of this would be certain electrolytes, like chloride, for example. Accepting hydrogen by chloride to create that hydrogen chloride or HCl can lead to an increase in acid contents of the body. Removing hydrogen from the concentration, or dissociating hydrochloride into hydrogen and chloride, can somehow reduce the acidity of our blood. The same way that carbon dioxide, for example, carbon dioxide plus water can form H2CO3. So carbon dioxide CO2 plus water H2O, if you combine them, that will create H2CO3, which is an acid, and accumulation of that can again lead to acidosis. The same way that if you mix sodium and bicarbonate, that will lead to sodium bicarbonate, and that's a base that can help kind of reduce the acidity of the blood. So these buffer systems can actually help regulate the blood pH by either accepting hydrogen ion or releasing hydrogen ions. The respiratory rate. The release of carbon dioxide from the lungs acts to make the blood more alkaline by reducing the amount of carbonic acid formed. As I mentioned earlier, carbon dioxide mixed with water. So let's say, for example, a patient was given too much narcotics or too much anesthesia. Then what will happen? The patient will have decreased respiratory rate. The patient will be retaining carbon dioxide, and that carbon dioxide can reversibly react with water to form H2CO3. So H2O, water, plus CO2, carbon dioxide, mixing them together will form H2CO3, which is carbonic acid. And more carbonic acid form will mean that the patient will have respiratory acidosis. Sorry. In contrast, again, the retention of carbon dioxide makes the blood more acidic. So in contrast, if you remove carbon dioxide from the system, sorry, that will lead to dissociation of carbon dioxide and water. Water will be reabsorbed, carbon dioxide will be eliminated, such as in the case of hyperventilation. So an increase in respiratory rate will mean an increase number of carbon dioxide being released into the atmosphere, and that can lead to an increase in the blood pH because water will be dissociated from carbon dioxide. So again, the respiratory rate can either increase the carbon dioxide level, thus increasing carbonic acid formation, or if there is an increase in respiratory rate, carbon dioxide will be released, thus dissociating carbon dioxide from water. Water will be reabsorbed, carbon dioxide will be released, leading to an increase in the blood pH or even alkalosis. And this is the reason why hyperventilation will cause respiratory alkalosis. It's because you're releasing too much carbon dioxide, thus removing or increasing the blood pH. The kidneys, I mentioned earlier, the kidneys are the master chemists of the body. So, being the master chemists of the body, the kidneys can actually eliminate hydrogen ions. If the kidneys notice that we have a little bit of an excess of the hydrogen ion circulating in the blood, then the kidneys can actually remove hydrogen ions by increasing the urine production and eliminating hydrogen ions via the urine, and that can help in again reducing the potential or the possibility of metabolic acidosis. So again, any increase in the blood pH higher than 7.45 can lead to alkalosis. 7.4 is the pH of any solution considered as neutral. But again, in the blood, it's between 7.35 to 7.45. So any blood pH higher than 7.45 indicates alkalosis, and any blood pH lower than 7.35 indicates acidosis. These are some of the normal values that you need to remember if you're trying to interpret normal acid-base values or arterial blood gases. Number one, blood pH. Remember that the blood pH is between 7.35 to 7.45. Anything below 7.35 indicates acidosis. Any blood pH higher than 7.45 indicates as alkalosis. The partial pressure of carbon dioxide, or the PCO2. The partial pressure of carbon dioxide, or PCO2, should be between 35 to 45 millimeters of mercury. If the patient is hypoventilating, if the patient has decreased respiratory rate, for example, the partial pressure of carbon dioxide will increase because the patient will be retaining carbon dioxide. So the more carbon dioxide you have in your system, the higher your partial pressure of carbon dioxide will be. So, let's say I was given too much narcotics, or I was given too much anesthesia, or let's say I sustained a head injury causing an increase in intracranial pressure, and I'm having decreased respiratory rate. I will be retaining carbon dioxide. The partial pressure of carbon dioxide will increase in my system, and more carbon dioxide means more chance of forming carbonic acid. Remember, CO2 plus H2O equals carbonic acid. And the more carbonic acid you have, the lower the blood pH will be. Consequently, if you're hyperventilating, if you're breathing too fast, such as in the case of anxiety, if you're scared of something, you're fearful of something, and you're hyperventilating, then you're losing a lot of carbon dioxide, thus reducing the carbon dioxide level in the blood and increasing the blood pH, leading to respiratory alkalosis. The bicarbonate level should be between 22 to 26 milliequivalent per liter. Bicarbonate is a base, and so therefore, um, any bicarbonate level higher than 26 will be associated with alkalosis, and any bicarbonate level lower than 22 will be associated with acidosis. So, let's look at how we can interpret those ABGs. um, let's see if before we go to interpretation, I want to talk about certain, acid-base disorders. Like for instance, the partial pressure of arterial oxygen or PO2 should be between 80 to 100 millimeters of mercury. So you want to maintain a partial pressure of arterial oxygen or PO2 level between 80 to 100 millimeters of mercury. 60 to 79 millimeters of mercury PO2 is considered mild hypoxemia. Again, 60 to 79 millimeters of mercury is considered mild hypoxemia. 40 to 59 millimeters of mercury is considered moderate hypoxemia. And any partial pressure lower than 40 millimeters of mercury is considered severe hypoxemia. The autosaturation of the patient should be between, or should be above 95% all the time. And don't worry about the base excess. The base excess, we will discuss that probably in, I don't know, maybe in NCLEX preparation, BN440, but it's between -2 and +2. Alright, so let's talk about some acid-base imbalances. Number one, let's talk about acidosis. As I mentioned earlier, acidosis occurs if the blood pH or serum pH falls below 7.35. A lot of times, this can be associated with depression of the central nervous system, such as in the case of, again, increased intracranial pressure. Let's say the patient sustained a head injury, contusion, sorry, contusion, somebody hit the patient with a baseball bat, sustaining subdural hematoma, intracerebral bleeding that can lead to decreased level of consciousness. That patient will be susceptible for acidosis. Why? Because the respiratory center will decrease. The respiratory center will be depressed, decreasing the respiratory rate of the patient and potentially retaining more carbon dioxide. And the more carbon dioxide retained, the more carbonic acid will be formed, and that can lead to acidosis. So, for acidosis, remember we have two types, either respiratory acidosis or metabolic acidosis. For respiratory acidosis, a lot of times respiratory acidosis is caused by depression of the respiratory center or decreased respiratory rate. Let's say the patient was given too much narcotics or the patient was given too much anesthesia, decreasing the respiratory rate. Or the patient is suffering from, let's say, respiratory disorders like lung collapse, pulmonary embolism, asthma, for example, COPD. Those type of conditions can cause retention of carbon dioxide, and retention of carbon dioxide will mean formation of carbonic acid. So any type of hypoventilation, right here, will cause hypoxia. Why? Because the patient will be retaining carbon dioxide. I'm sorry about that. Let's go back. Okay. So, in patient with respiratory acidosis, a lot of times you will see rapid and shallow respirations, and because the patient is retaining carbon dioxide, remember I told you carbon dioxide is a volatile acid. It's a potent vasodilator, so it will dilate the blood vessels, causing a drop in the blood pressure. The patient may be manifesting signs and symptoms of shortness of breath, such as in the case of asthma, or maybe even pulmonary embolism, headache because of vasodilatation of the blood vessels, cerebral blood vessels, any type of acidosis, whether it's respiratory or metabolic, will kick potassium out of the cell. Remember in the previous video I told you potassium is basically an intracellular cation. But in case of acidosis, that potassium will be kicked out of the cell and potassium will go into the blood vessels or inside the intravascular compartment that can lead to hyperkalemia. And if that happens, then it will affect the function of the heart. It can cause cardiac dysrhythmias and it can lead to some fatal, cardiac dysrhythmias. Drowsiness, dizziness, disorientation, these are just some of the possible, manifestation of respiratory acidosis, muscle weakness, hyperreflexia, and again, like I said, a lot of times, these are caused by decrease in the function of the respiratory system, may be brought by too much anesthesia, drug overdose, atelectasis or lung collapse secondary to maybe even pulmonary embolism, pneumonia, COPD, asthma, those type of conditions. On the other hand, metabolic acidosis, again, the possible causes of metabolic acidosis would be increased hydrochloric production or increased hydrogen production rather, such as in the case of diabetic ketoacidosis, hypermetabolism, decrease in hydrogen ion elimination, such as in the case of end-stage kidney disease or kidney failure, decreased production of bicarbonate or HCO3, such as in the case of liver failure or dehydration, or increase bicarbonate elimination. So if you lose too much bicarbonate, remember bicarb is a base, and so if you lose too much of bicarbonate, such as in the case of diarrhea or if the patient is having fistula or abnormal communication between let's say rectal fistula or fistula in the large intestine causing too much loss of bicarbonate in the peritoneal cavity, then that can lead to metabolic acidosis as well. If the patient is having respiratory acidosis, you will notice that the patient will have decreased respiratory rate. But in the case of metabolic acidosis, what you will see is that the patient will have fast, rapid, deep breathing, and the reason for that is, and usually we call it Kussmaul breathing, deep rapid respiration. And if you smell or if you try to smell the breath, a lot of times it's fruity odor. Reason for that is because the breath of a patient with metabolic acidosis would contain a lot of acetone and it's pretty other because of too much hydrogen ions, and so the patient will have that acetone breath, um, that causes the fruity odor breath of the patient with Cosmo. Headache, decreased blood pressure, and again, hyper K. Remember, any type of acidosis will kick potassium out of the cell. Muscle twitching, warm flesh skin, nausea, and vomiting. These are just some of the signs and symptoms that you will see in a patient with metabolic acidosis. Okay, so again, any form of acidosis, respiratory or metabolic, will cause potassium to go outside of the cells, leading to hyperkalemia. So whether it's metabolic acidosis or respiratory acidosis, potassium will go outside the intracellular compartment, and it will go to the intravascular compartment that can lead to hyperkalemia. And in that case, your main concern should be the cardiac function of the patient, because you know that hyperkalemia can actually cause fatal cardiac dysrhythmias. So what are the potential or possible causes of acidosis? Respiratory acidosis is almost always caused by hypoventilation related to maybe drug overdose, anesthesia overdose, pulmonary edema, such as in the case of congestive heart failure with pulmonary edema, chest trauma, or any type of neuromuscular disease such as Guillain-Barré syndrome or myasthenia gravis, and any type of airway obstruction, COPD, pulmonary embolism, asthma. Those are potential causes of respiratory acidosis. For metabolic acidosis, some of the most common cause would be DKA, diabetic ketoacidosis related to type 1 diabetes. Shock, if the patient lost too much blood, that leads to decreased intravascular blood volume. Overdose of aspirin or any type of salicylates. Severe diarrhea causing loss of too much bicarbonate. Kidney failure, decreasing the elimination of hydrogen ions from the system, and sepsis. All of these are potential cause of retention of hydrogen ions, thus decreasing the blood pH. Remember, more hydrogen ions, lower pH, so lower than 7.35. Or if you have less bicarb compared to acid or hydrogen, then that can lead, such as in the case of severe diarrhea, if you're losing too much bicarbonate, then that can potentially lead to metabolic acidosis. How about higher or pH higher than 7.45? pH higher than 7.45 leads to alkalosis, and whether it's respiratory or metabolic alkalosis, it can cause hyperexcitability in both the central nervous system and peripheral nervous system, and sometimes this leads to extreme nervousness, muscle spasms, and it can even lead to convulsions and potentially death. Respiratory alkalosis usually caused by hyperventilation, or if the patient loses too much carbon dioxide, such as anxiety or extreme emotions, such as have you ever attended funerals? You will see a lot of patients hyperventilating because of emotional distress. If the patient is in mechanical ventilation, that could be another or a potential reason as well. So possible cause: respiratory alkalosis, any condition that causes hyperventilation, anxiety, fear, extreme emotions, anger that can cause respiratory alkalosis. Pulmonary embolism in the initial stage can cause hyperventilation because if the patient is not getting enough oxygen, the tendency is to breathe faster, causing elimination of more carbon dioxide. Patient with respiratory alkalosis usually will experience confusion, maybe decreased level of consciousness instead of full consciousness. The patient may appear drowsy, lethargic. Patient will feel lightheaded, may even complain of nausea or vomiting. Can lead to seizures. Usually, the patient will have deep and rapid breathing or hyperventilation. Heart rate will be faster than normal. Blood pressure may not be affected significantly, but if you have acidosis if you have hyperkalemia in acidosis, in alkalosis, you will have hypokalemia. The patient may complain of numbness, tingling sensation in the extremities, and a lot of times they will pass out. Metabolic alkalosis usually is caused by excessive loss of hydrochloric acid from severe vomiting, gastrointestinal suctioning. So if you're suctioning the patient every now and then, you're not just removing, gastric contents. Well, you are removing gastric contents, but you're also removing hydrochloric acid and hydrogen. Therefore, it can lead to metabolic alkalosis. Excessive administration of a strong base called sodium bicarb, sodium and bicarbonate. Again, that's another buffer system. Use of diuretics or excessive use of diuretics that causes elimination of hydrogen ions. This can lead to confusion, nausea, vomiting, diarrhea, of course, tachycardia, cardiac dysrhythmias. Remember, hypo or hyper K can cause cardiac dysrhythmia. So you don't want the patient to have hyper K nor hypo K because both of them will cause erratic transmission of electrical impulses in the heart that can lead to fatal cardiac dysrhythmias. Patient may complain of tremors, muscle cramps, tingling in fingers and toes. So again, in summary, causes of alkalosis, hyperventilation, respiratory alkalosis. If you're breathing too fast, you're losing carbon dioxide, then that can lead to respiratory alkalosis. Initial stage of pulmonary embolism, because the patient will be breathing fast, most likely. Pregnancy. Why pregnancy? Because if the woman is pregnant, then the gravid uterus can impinge on the function of the respiratory system, and the patient will tend to breathe faster because the diaphragm will not have the capability to have its full descent, and so the amount of air and gases that can be exchanged will be minimal, causing an increased respiratory rate. High altitude, so if you go up in the mountain, because there's less oxygen molecules in the atmosphere, the tendency is you will breathe faster. Fever will also cause an increased respiratory rate. So any type of hyperventilation can cause respiratory alkalosis. And for metabolic alkalosis, again, overuse of antacids neutralizing your hydrochloric acid in the tummy can cause metabolic alkalosis. Some potassium wasting diuretics, such as hydrochlorothiazides, will increase the loss of hydrogen ions from the system, and loss of gastric juices due to continuous suctioning can potentially, or even excessive vomiting, can cause metabolic alkalosis. So points to remember in if you're trying to remember this, remember in acidosis the pH is lower than 7.35. In alkalosis the pH will be higher than 7.45. Respiratory function indicator is the partial pressure of carbon dioxide, and if you want to examine the function of the metabolic system, then you need to look at the bicarbonate level. So we will talk about interpretation of ABGs in the next video. But for now, we just want to remember that uh, any blood pH lower than 7.35 will cause acidosis. Any blood pH higher than 7.45 indicates alkalosis. So for respiratory acidosis, you want to look any type of acidosis, whether respiratory or metabolic. You want to look at the blood pH lower than 7.35, and whether it's respiratory or metabolic alkalosis, you need to understand that any type of alkalosis, your blood pH will be higher than 7.45. For respiratory acidosis, your partial pressure of carbon dioxide should be higher than 45 millimeters of mercury, simply because the patient is retaining carbon dioxide, and the bicarbonate can either be normal or it will be elevated if the kidneys are trying to compensate. And I will explain that in the next video during ABG interpretation. Respiratory alkalosis, PCO2 will be lower than 35 millimeters of mercury, because the patient is trying to to eliminate excessive carbon dioxide. Okay, um, that's all I have for you, and I will see you in the next video. Thank you.